Well, we're back from the break. Myself and Dr. Christensen, thank you again for coming on, and I think we'll try and do this on a regular basis, and you be here, and I think we want to promote what we're doing at the Wellness Center, and we were talking about that a little bit break, and I was talking a little bit before the break, which is that what we want to do is to get out of the traditional medicine role and want to help people understand nutritional support because we are unfortunately a function of what we eat. We want to help them get more physically active because you know better than I do that you have to be active. You have to keep moving. If you have arthritis or you have whatever it is, a lot of the things I prescribe keep people in bed, to keep people still. You need to have that approach to get people moving.
Yes, absolutely. I mean, when you stop moving, what happens? You put on weight, you lose muscle mass, you lose your energy, you lose everything that it takes in order to be healthy. And sometimes getting out and going for a walk might hurt a little in the beginning, but you know what? It's just things that you got to do. You got to keep that heart, you got to get that heart rate up. You got to maybe work up a little bit of a sweat, which is going to be awfully easy here in Pahrump in the next few weeks. So make sure you hydrate.
Yeah, and a lot of people, I have this saying, it's like, I can'ts, right? I can't do this, I can't do that. And I think that's really, I don't want to, but a lot of times it really is, but they need somebody to help them, show them what they can do. I mean, you can understand the musculoskeletal limitations some people have, but you can also work with them and help them overcome some of those things so that they can learn to be physically active and work within something. Obviously, I see people in their late 80s, they suffer from muscle wasting and muscle weakness. But on the other hand, I mean, with the right conditioning, the right help, they can be very active.
Absolutely.
And they can help that arthritis because most of what we suffer from is degenerative arthritis. That is the arthritis of wear and tear, and that kind of arthritis is when you sit, your joint it gels. It's a gelling phenomenon, and the pain comes from when you have to break that gel apart and separate those bones. That's where you get the pain. But once they get going and they get using, so being active is really what it's about.
That's why when you get up in the morning and you don't feel good, you can't move until after you take a hot shower and you've got the blood flowing around your back and through your shoulders that things feel better. You have to get up, you have to move. I talk to my patients and I ask them, what's the first thing a cat does in the morning when it wakes up? It stretches. Dog stretches. Human beings get up and go to the toilet.
That's not stretching, right?
That's not stretching. And it doesn't have to be aggressive. There's easy stretching techniques for the low back and for the shoulder and even, for the neck that you can do before you get out of bed, just to kind of stretch those muscles and get those joints moving so it doesn't hurt so bad before you get in the shower and get moving.
Or you get up and you get going. I personally like to get up and just, I don't care how I hobble, as long as I get to the coffee machine, right? That's my, but no, I think you're exactly right. And the other thing is sleep. We hope that we're going to be putting in a sleep lab in the Wellness Center. We're working on that. I can't tell you when that's going to be coming on, but I see that as a huge problem today. I see it all the time in chronic fatigue. I see it all the time in people who are on pain medication, who are on sleeping aids. They don't realize, and I've talked about it numerous times on the show, that when you take some central nervous modulating agent, whether it not a stimulant, but obviously a depressant, whether it be a sleeping pill or a pain pill, you're going to lower your respiratory rate and you're going to lower your respiratory drive. And if you're slightly overweight, got maybe a short neck, and maybe are not on the most comfortable bed, chances are you're probably going to desaturate at night. And for males, that desaturation drops your testosterone level. Which further decreases your muscle mass, further decreases your energy, further decreases your drive.
Explain to them desaturate.
Well, desaturate means basically that normally the amount of oxygen, saturation like water, we talk about humidity, right? Humidity in this area is 35%. What does that mean? That means there's 35% water in the air. The same is true of the saturation of oxygen in your blood. So if I tell you, put a pulse ox on your finger and you take a deep breath, and you take 3 breaths and you'll see it go from maybe 96 to 98%. That means there's 98% oxygen in your blood, okay? What is safe is anywhere from 93 to 99, okay? And if you're trying to heal a wound and you have poor circulation, that's why they put you in hyperbarics so that your oxygen concentration goes above 100%. Yeah, it's not 100%, but it's 100%. It's saturated, and that's how you get oxygen to a wound that you can't get to. It's hyperbaric chamber. But most of us exist about 93, 95, and some people are 98% if their lungs are good. As you get COPD and as you get other heart and lung conditions, you start to see those saturations drop. If you are at 92 sitting here not moving, I guarantee you that when you get up and move 10, 15 steps, that saturation is going to drop down into the 80s. For Medicare guidelines and most insurance companies, if your saturation falls below 88%, for 5 minutes or more during the day, you qualify for oxygen. And the reason why is because when your saturations fall low, the circulation from the heart to the lung, the pulmonary circulation, is very short. And it's a very easy circulation. But those blood vessels start to tighten when the saturations fall below 88%. And if they tighten for enough and for long enough, they develop a condition called pulmonary hypertension. And that's not a hypertension that you can treat with medication. In fact, the only one they treat it with sometimes would be Viagra or other medications like that, because it does dilate all blood vessels, not just that one. But that being said, if that tightens too tight, you actually get right ventricular function, and you get less blood flow to the lungs, and you get further desaturations. That puts a strain on your heart, puts a strain on your right side and everything. So you don't sleep very well, okay, because your body has this natural alarm. It will not let you suffocate at night unless somebody's suffocating you, okay? But it will not let you suffocate. It will wake you up out of your sleep. So you never get into what they call REM sleep, okay? There's basically 4 or 5 stages of sleep, 1, 2, 3, 4, and then REM. And when you get into REM, that's the dreaming state. If you never get into REM, you never get good sleep. And therefore, you're tired.
So the people that are using the opioids, the pain medication, it interferes with the respiration. Typically they have a problem with the saturation.
Yeah, it interferes, it lowers respiratory drive. Okay, so, and it causes a condition called alveolar hypoventilation. And what that means in English is alveolar meaning the end circulation of our lung, the little sacs that are in there, hypo meaning low ventilation. It just reduces the ventilatory effect. And so therefore your saturations are low. And if you just dip down into that 84, 80, 88, 85%, your body wakes you up. And so you never get to sleep and you wake up. And this is what people are telling you, I've been driving down the road and all of a sudden I'm kind of, if you're one of these people that go home and you sit in a chair and the first thing you want to do is do this and you haven't eaten, chances are you might not be saturating very well at night. And if you're on any type of sleeping medications or if you're on anything that helps get you below the conscious level and you don't know, it suppresses, it actually suppresses your alarm system that wakes you up, you'll actually drop lower in the saturations, which is actually more dangerous for you. And you'll actually be more fatigued during the day because you're doing it. And when you put this little pulse ox, I've shown it, I've had it on the slides. You actually can watch the oxygen levels, and as you relax and you get into sleep, the muscles here in the back of your throat, they tend to relax, and they close off your airway. That's obstructive sleep apnea. And you'll see the pattern, and you'll see the oxygen levels dip, and then they go down to like 82, 89, and all of a sudden then they wake back up. And then about 2 hours later, they wake back up. And literally, one of the things that people are afraid of is the CPAP, wearing a mask at night. But sometimes if you just put people on low oxygen levels, it tightens up the muscles here. And they actually don't have to wear a mask, okay? And so it's so important for people. We're all overweight today. And I say all of us, but not all of us, but a lot of us are. And there's too much good food out there, and there's not enough activity. And that's why we all gain weight. And we're a sedentary thing. So there are a lot of people who are basically more inclined to basically have that, increasing folds in their neck. And I mean, you can look at the people. I mean, if they got, and I say this jokingly, more chins in a Chinese phone book. I mean, they basically are going to have sleep apnea. Mm-hmm. They're going to have problems, and then it cascades into other problems. And then it's. I think it all starts with sleep. I really do. Mm-hmm. I really do, and I think it's very important. And people say, "Oh, I sleep fine. I go to bed. I wake up, and I'm like." Yeah, but do you really watch yourself when you're sleeping? Do you really know how you sleep? No, you don't. That's why it's as simple. It's like even if you had to pay for it out of your pocket, it's a $70 test. Yeah. And so much information can be yielded from that. So I'm so excited about having a sleep lab so that we can actually test those people that need it. Exactly. Did I explain that good enough for you? Very good, very good. Okay. Very good. Thank you, Doc. A lot of times I start talking and I'll basically just get on a rant and start talking, and these people are looking at me like, and I'm wondering at the end, do they really understand me? Or that was an excellent explanation. Are they too embarrassed to say I don't really understand it? And so that happens sometimes. So, but which reminds me to the public out there, if you're in a doctor's office and a doctor is giving you an explanation, if he sits down and actually gives you an explanation and you don't understand it, please don't have that deer in the headlights look. Just ask him, I don't understand it, and make him explain it to you. And if he can't explain it to you, or she can't explain it to you, then chances are maybe they don't really know how to deal with it too. So I think it's important getting into treating, about diagnosing something properly rather than just masking the symptoms with something. So there's always a cause, and there's always a story that goes along with every disease. Exactly. I find in our practice over at the Wellness Center, the more I can educate the patient as to what we're doing and why they feel the way they do, the better the compliance, the faster they get better, and they stay with the exercise programs that we give them longer. All the way around. So you so much want to keep them out of the office if possible. Anyway, we're going to go to break, and we'll be back with the second half of the show. Thank you for tuning in.